The COVID-19 Delta variant has many of us wondering, are we in for a round 2 of last year? Here to help us better understand this latest strain and how to best protect ourselves is Dr. Michael Sweat, who is leading MUSC's COVID-19 Epidemiology Intelligence Project. Doctor, thank you so much for joining us today.
Pleasure to be here. Thank you.
What can you tell us about this Delta variant?
Well, I think many people are aware the Delta variant is a version of the virus that originated originally in India, and it has a couple of characteristics that are very concerning. The main characteristic that's of concern is it's extremely transmissible. So the earlier version of the virus that we've been dealing with, the Alpha variant, each person who got infected tended to infect about 2 to 3 people. With the Delta variant, that doubles. Each person who gets infected is infecting up to 6 other people. So it's spreading very rapidly. The other characteristic that's of great concern is people who are infected with the Delta variant have high viral loads. That means they carry a lot of virus. And because of that, we think they infect other people more rapidly. So it's a really big concern, and we're seeing the outcome of that with higher rates of infection right now.
Well, this sounds terrible. So the difference, though, between the initial COVID-19 that we experienced last year versus the Delta variant, do the symptoms manifest themselves differently?
For the most part, it's a similar pattern. You have the same basic symptoms. It does look like the Delta variant lasts a little longer, and that people start having symptoms a little earlier and then they last a little bit longer, but more or less the same basic syndrome that people were having with the earlier versions.
And when we're talking about transmission, so we were and still are using face masks. It's almost making a comeback, really. More people are urged to wear face masks when indoors to avoid large gatherings and so forth. But the transmission of the Alpha variant, as you described it, versus the Delta. So why is the Delta so much more severe in that respect?
Well, again, it's really driven by that fact of high viral load. That makes it much more transmissible. And it is really a good idea to wear a mask right now, particularly if you're not vaccinated. So people who are vaccinated have dramatically lower rates of infection, and the vaccines work incredibly well at keeping people who do get infected who've been vaccinated from having serious illness, ending up in the hospital, and dying from COVID. We're seeing an increase right now at MUSC of hospitalizations, and it's almost all among people who are unvaccinated. So it's really important to get vaccinated, and if you've been waiting, now is the time to do it.
Okay. And for someone who has been vaccinated, can they transmit the virus to somebody else?
Yeah, that's a great question. The CDC does believe that can happen. There is some controversy about the data. There was a big outbreak that occurred in Massachusetts, and they documented many people who had gotten infected who had been vaccinated, but they had very high viral loads. They carried a lot of virus in their nasal passages, and that led the CDC to be quite concerned that they could therefore transmit that virus on to other people. I do want to say, though, that the vaccine really is effective at lowering the risk of getting infected and extremely effective at lowering the risk of hospitalization and death. So I don't want people to walk away thinking, oh, the vaccine doesn't work. The vaccine works very well, but some people still get infected and they could potentially transmit that to other people.
How about children, the elderly? Are these two demographics that are particularly vulnerable?
Yeah, the elderly in particular. There's some data that's come out of Israel that has shown that people who are above 65, there is some waning of the efficacy of the vaccine, and there's discussion about whether to do boosters for those populations. But all in all, the vaccine is still really effective and helpful for people who are older as well. The vaccine rates are quite high in our state among people over 65. Obviously, if children below the age of 12 are not eligible to be vaccinated, they can definitely pick up the virus and they can spread the virus. Young children tend not to have as serious an outcome, although some young children have really suffered from COVID, been hospitalized and died. So we're all waiting to see the approval for vaccines for younger children as well.
Tell us a little bit more about the MUSC COVID-19 Epidemiology Intelligence Project.
Right. So what we do in the project, we have a dashboard that we keep up on the web. And every day during the week, every day, we update that with the current metrics of what's going on with COVID in our area. So it's been a good resource for people in the community, for healthcare workers, for policymakers and others to get a quick look at what's happening in our community.
Okay. And one last message for our viewers. From this point forward, what do you recommend people do to stay safe, to keep people that they live with safe, and just best practices for staying healthy?
Absolutely. First of all, I want to point out that right now we are seeing a dramatic increase in cases. We saw in the past week the number of cases diagnosed increase 145%. So we went from 30 cases per day in one day, from 30 cases per day for every 100,000 people to 47, and that was yesterday.
And that's here in South Carolina.
Here in the Tri-County area.
In the Tri-County area.
So we are definitely seeing a dramatic increase. It is most likely due to the Delta variant. It's been spreading from Missouri down through Louisiana and Arkansas into Florida. Florida now has the highest case rate in the country, higher than it had in the past, ever.
I heard about that, yeah.
So we are beginning to see those sorts of increases. So I would tell people in the next weeks ahead, this is a critical time. And people who are not vaccinated in particular, I think are extremely high risk. They should definitely wear masks, avoid crowded spaces indoors. People who have been vaccinated, I still think it's prudent to, during the weeks ahead, when we see this sort of high transmission rate occurring, to also be careful, especially if you live with people who are vulnerable, elderly people, people with immunocompromised situations or comorbidities, young children who have not been able to be vaccinated. I would say over the next few weeks, really watch these case numbers. When they begin to drop, I think people vaccinated could loosen up on their restrictions, but we're moving into a very high transmission period, and I would advise people to be careful.
Dr. Sweat, thank you very much for your time.
My pleasure. Thank you for having me.
We're back in 2 minutes.